Okay. So I will say that when she asked me to do ethics this year, I was like, what do you even talk about? Like, I have no idea what to even, and she was like, well, you can look it up here and there. I was like, all right, well, we'll see. And I ended up with this topic, and I swear it has been my absolute favorite presentation I've done. Even when I talk about Encore, this is just, it was so interesting. I found myself just like diving into the research so much on this that I would forget that I was supposed to be writing an actual presentation. And I'd be like, oh yeah, I need to put some stuff down on some slides. So I hope you all have a little fun with this one too. I'd like for you all, I know it's the end, it's been 2 long days, but I'd like for y'all to be a little interactive, if you will. My assistant, my director of clinical operations, would be glad to bring a microphone around and let you guys give me your opinion on a few things as we go through. So please, I hope you had a little coffee after lunch and you're ready for this. So we're going to talk about social media, so to post or not to post, and the ethics of it all. So we're going to discuss the, oh, that's freaking me out. That's 2 different slides there. Okay. So we're going to talk about the ethical boundaries that you should have for social media. Are you breaching confidentiality? And do you maintain are you professional on social media, and should you even be professional on social media? Is it your business to act how you want? Or can your employers kind of come in on that? So we're going to end up with that talk. So when HIPAA was first started, social media wasn't really even talked about. There was really nothing, there's no Facebook, you know, so it wasn't addressed in the words social media at all in the HIPAA rules. So that means we could just do what we want, right? We can just post whatever we want, say whatever we want, take whatever pictures we want, because it's not addressed in HIPAA. But that's not exactly true, because there are wording that has the meaning that goes back to social media. So the wording that is actually in the ruling is you cannot post PHI in a public domain. You know, that was probably when they put that in there, is probably thinking of like studies or, you know, articles that people would write. They probably were never ever thinking of somebody just feeling froggy and posting and complaining about a patient on Facebook. You know, that was probably never even in somebody's thoughts. But the amount of HIPAA violations that are created on social media every day is crazy. We're going to talk about several of them that I found the most interesting, but I swear, just Google it when you get home. You can get lost in it for hours, just at the foolishness of some people too. It's crazy, the things that they think are okay to post on Facebook or on Snapchat. I didn't even put anything in Snapchat in here because that's how bad the things that I saw that were done on Snapchat, and so many criminal offenses. People are in jail because of Snapchat. So many criminal offenses. So, I mean, it's interesting to keep reading on about that. So, we're going to talk today about, do you think it's a HIPAA violation or do you not? And then I'm going to break it down, and this is kind of the way the presentation is going to go. So hopefully, Katie, somebody might have something to say here. So if you post a picture of a pediatric patient on social media after the parents give you verbal consent, is that a HIPAA violation? If you are working on the cutest baby in the absolute world, and you just have to share that moment with somebody, and the parents say, oh yeah, I know, it's adorable, you post it. Is that okay? Is that a HIPAA violation? And do you post a picture of a patient on social media without the verbal approval of the patient? So let's start with the first one. Who thinks this is a HIPAA violation in here? Okay. Anybody want to tell me why they think it's a HIPAA violation? Raise your hand if you'd like to talk. That's a good point, yeah. Anyone else? Yeah, Ethan? That's a very good point. You do not have written consent. One said adolescent, one said you do not have written consent. So that goes back to this one, verbal approval, without verbal approval. So let's go to the next slide. These are actual cases that happened as examples of both of the topics we just talked about. So the first one is actually a social media influencer. She was on a show called Southern Charmed. I never saw it, but she was also a nurse in South Carolina who lost her license because she was posting videos of her patients. She was an in-home nurse. She was posting pictures, videos. I actually saw those videos and those pictures. I chose not to put those in the slides because, you know, that's just not, that wasn't appropriate to the families, to the kids. So, but they're out there. They're everywhere. And that's also something you need to think about. When you post it on social media, it's there always. So she did not get jail time. She did lose her job, and she did lose her nursing license. She had even told people in comments, because I saw screenshots of the comments, I can't do that. That's a HIPAA violation. But then she direct messaged the videos and the pictures. I guess she thought everybody was keeping her secret. But one of the videos I saw was a direct message, and that's the person who actually reported her. It said the patient's name in the video, where they were, the actual location of where they were standing at the time. So it was crazy to think she could just do that. But it was private message, so she thought it was okay. So the next one is quite disgusting, honestly. This was posted on Facebook by a nurse. She was in a neonatal intensive care unit in Jackson Memorial Hospital, and she posted 2 photographs. One was on Instagram and one was on Facebook of a baby who had a rare birth defect. Its abdominal wall was open and its intestines were outside of its body. She thought it was appropriate to post not only the pictures of the baby, but to post under the pictures, my night was going great, then boom. And your intestines supposed to be inside your body, baby. Like, how disgusting. Could you imagine the mom seeing that? And then she went a step further and hashtagged the actual disease that the baby had. And it's like, what in your mind would make you think that is appropriate? And her coworkers immediately brought it to administration, and she was fired. But could you imagine that mom? That was shared on Facebook. That was shared on Instagram. That poor picture is already out there, and it's going to stay out there. So now let's talk about authorization. So I'm not just up here to gossip. I'm here to teach you too. So we're going to talk about why these are wrong, and then we're going to talk about how they could have done this better. So the meaningful description of the information must be used and disclosed to the family or the patient themselves on the authorization. Has to be a written authorization. A meaningful description of the purpose or use. So you can't say we're going to use it in a study and then post it on a social media platform in some other way. An explanation that the information may be further disclosed. The individual's right to revoke the authorization. Remember that. There's a lot of questions coming up about that one again. And an expiration date has to be on the authorization. Now here's the thing. We just said it. Once it's on social media, it's everywhere. You can never truly pull it back. People share, people screenshot, people can text the screenshot. So once you post it on social media, there is no true expiration date. You have no control over who sees it, shares it, brings it back to someone else. So you have to make sure that in that disclosure, if you plan on putting it on social media, that you do not have reliance upon clause. Because I'm going to post it here, and if you tell me, yes, you want it off, you want this done, or the expiration date comes up, I'm going to take it off. That clause will help you because it will say, but I cannot guarantee no one else shared it anywhere else. So that needs to be in there as well. So this one was really interesting to me. This one I thought a lot of people would not really understand why this was a HIPAA violation. I've asked a few people and I've gotten mixed responses. So this one was a nurse who posted in a Proud Parents of Unvaccinated Children's group, because you know those Facebook groups, they're uber positive. You know, they're the greatest things. So she posted because she had saw measles for the first time in a child. And so she wanted to take to the unvaccinated children's group, which she was a member of because she herself did not want her children vaccinated. And she wanted them to know that this kid was super sick. This is the first time she had saw it, and many of the ER docs, other nurses, other healthcare workers had never seen it either. And her point was that this kid was super sick. You could not even touch this child without the kid crying or moaning. And he was in terrible pain, ended up in the ICU. So she wanted to make the point that all the non-vaxxers shouldn't just make assumptions about these diseases because they would probably never see them themselves. Now, this is in a Facebook group. So who thinks that that was a HIPAA violation? Just 2? Anybody else? 3, 4, 5? Okay. So let's talk about why it was a HIPAA violation. The nurse's place of employment was on her Facebook profile. So anyone in the group knew which hospital she was referring to. The parents of another child that was admitted to the same hospital saw the post. She was a member of the group, and her child was admitted to that hospital at that time. She took a screenshot of it. She posted it to the hospital's Facebook page. So she had a lot of people panicking at that moment. This was a city that had a 95% vax rate. Yeah, so you've only got 5% out there that possibly didn't have vaccinations. So less than 10 cases of measles were even diagnosed in the last 10 years. Some slim pickings out there. I mean, you're really going to be able to narrow this child down. The nurse posted what the disease was. Her place of employment was listed on her profile, so it was possible for the child to be identified, even though the name was not revealed. She got fired from her job. I mean, you don't think about it like that. There's a lot of this stuff that I'm going to talk about today that I'm like, man, I never would have even thought of it like that. So what do you need to know about social media and HIPAA? HIPAA violation is posting any identifying information about a person without their written consent. And not just written consent, but the written consent that has all of those topics that I just shared with you guys. Images posted on private social media accounts without patient consent violates HIPAA. Who in here thinks if you posted a picture of a patient's home, and I saw this on my actual Facebook, this person didn't work for me, it wasn't my business, but who do you think would be like posting a picture of a home patient's house that was dirty outside? It was like a bunch of garbage and this and that with the caption under it, "This is what I see every day when I go to work." I mean, who thinks that's a HIPAA violation? Yeah. I mean, it's work. You plainly said, "This is my patient's home." Who drives by it? Anyone could drive by that and see that, you know? People don't even think about that kind of thing. I mean, I bet their Facebook listed where they worked too. So PHI on social media is permissible, again, under HIPAA, only if you have the written authorization from the subject. And this goes on again to talk about that it's very limited when you can pull that information truly back if they decide they want to change it. So this one I had to think about for a while. Is it a HIPAA violation to look your patient up on social media? You leave that house and you're like, Lord of mercy, there's something else. I got to look them up. You're at your patient's house and you think, I wonder who that man was in that living room. I'm going to look him up and see who he is to them. Is that a HIPAA violation? Who thinks it is? Okay, why? Somebody tell me why you think it is. I want to see. Come on, Katie, get up here with that microphone. Somebody tell me why you think it is. I'm going to call one of my friends out. Angie, you raise your hand. Go on, Katie, tell her why. Oh, okay, go ahead, Randy.
Of course, I'm old school, but I think anything you do with your job, you don't post it.
That's a good point. Exactly, yes. Yep. That's my last slide. You done predicted the future.
Next up is Angie.
Well, even though it's not your patient, it's still family of the patient, and it'll still get back to them.
It could, yeah. So that's a good point. So the next one is Is it a HIPAA violation to discuss a patient's medical information on Facebook Messenger with that patient? I read a study while doing this research that millennials and younger, like 70% of them thought it would be okay to contact their physician on Facebook Messenger. I was shocked by that number. I actually asked my husband. He's like 10 years younger than me, and I was like, would you message your doctor on Facebook? He was like, well, if we were friends, probably. And I was like, ain't nobody wants to hear it from you when they're at dinner on Facebook. Like, that's crazy to me, you know, but that, I mean, 70%, that's a lot of people. So who thinks it would be a HIPAA violation if your doctor answered your questions on their Facebook Messenger that you messaged them about? Yeah? Okay, so let's break these down. So the answer is possibly. It could be a HIPAA violation. I didn't want to give this one 100% yes on the research I done, but let's think about it like this. It is definitely not a HIPAA violation just to look a patient up on Facebook, because information on Facebook is posted by individuals who are aware, or should be aware, they are publishing information about themselves in a public domain. Okay? However, how'd you get that patient's name? You didn't think it up out of the blue. Does your device, is it work? Is it your work device? Is it encrypted? Does it have your company's policy for password protection? Which ours is like, well, Jason, 20 letters and a number and stand on your left foot and hit, yeah. So, you know, is your phone that kind of password protected? You know, these are things that you think, oh, I can just look somebody up on Facebook, it's fine. But it's not, because what if your phone gets stolen? What if your Facebook gets hacked? That patient information is then out there. And we've all gotten those messages. Don't accept a friend request from me, I got hacked. You know, that happens all the time. They can see your information. And they can see your patient's information. If you look it up on a computer, does it meet your company's HIPAA requirements, your password protection? Does your boo got your password? I mean, there ain't many people in here, I'd say, that your significant other is just going to be like, yeah, I can't look at your phone at all because this is just HIPAA password protected. You know, no. It's best if you can always have a work phone and a boo phone, because you got to keep it separate. You got to keep it separate. All right, so we'll go to the next one. Okay. So I'm picking on Facebook a little bit because also throughout my research I saw that in the age group that I felt like the majority of our Facebook, our older patients would be in, they all were like more Facebook. Younger generations are the Twitter and things like that, but I'm more so picking on Facebook. However, this is applicable to all social media platforms. They're not foolish. They're not getting in the HIPAA game. There's no reason for them to. So I pulled this statement out about Facebook, but no social media platform has a BAA, will sign a BAA with anyone, will attempt to even say they're HIPAA compliant. Because they don't have to. They don't want to get in the middle of that. So they don't. So no platform that I found is HIPAA compliant. Now this one is something very unique, and I'm not 100% sure y'all are going to be reading that up there, so I'm going to read to you. This is a physician. This is an actual screenshot from the physician's Facebook. So I had a patient who has chosen to either no-show or be late, sometimes hours, for all of her perinatal visits and ultrasound and NSTs. She is now 3 hours late for her induction. May I show up late to your delivery? Now, I know y'all probably can't read that, but I just want you to point one thing here. You see that little globe? If you're not a Facebook user, that's public. That means that comment is public, and that's a doctor putting that comment out there. So did she break HIPAA in that first part? I mean, she's leaking out that it's her patient. You think that doctor's practice isn't easily to find on Google? You know? And the third thing she did in that just initial statement alone is she said that patient's getting induced today. So she gave the medical procedure that's happening today. And whoever this lady is probably late for everybody. So I'm just going to say that's also included in this because, you know, that's a characteristic of her too. That's going to narrow it down even more. So all of her friends, and some of them are doctors, commenting on this, you know, oh, why you cancel her? I wouldn't put up with that. Other people are, oh, I'm always early for my appointments. I would never do you like that. Well, she gets down because she feels like she has to defend her reasoning for waiting on this patient. And she says, here's the explanation why I have put up with it and not canceled induction prior stillbirth. Yeah. Yeah, y'all's reaction was kind of mine when I read this too, and I was like, that's going in my PowerPoint for sure. I mean, to just put that out there, it's horrible. And I mean, who knows that patient isn't her friend on Facebook or follows her in some capacity. That's a public comment. It's horrible. I couldn't find any other information on this one, if this was a fine, if this was anything, but it definitely got the attention of someone, but I could not find if she was fired or anything on this one. But this is why, yes, this definitely crossed the line. Her practice was easy to locate, the information about the medical procedures and the past medical procedures. She was just trying to vent, but you do not do that in a public platform. Okay, so I thought in this slide we would talk about what does cross the line. So there's 18 of these listed, and I'm going to hit the high points of them. Name, the geographics, like a subdivision, a zip code, anything that can identify patients. Address should not be put in there. All elements of dates that directly relate to the individual, such as birthdays, of course, also shouldn't be something you would post. Telephone numbers, fax numbers, email address, social security numbers. Medical record numbers. This one kind of shocked me because I'm like, oh my God, we talk in medical ID numbers all the time. We don't ever say patients' names, we say numbers. So that one, I was like, whew, we're going to have to be a little more careful maybe. So that one hit me because, you know, you got to be careful even when you're giving out a number ID that relates to the patient. Health plan beneficiary numbers, account numbers, certificates, license numbers, vehicle identifiers, like, I don't know, taking a picture of a patient's house with their car sitting there with their license plate showing, because that's what was on the picture I talked to you about earlier. Devices identified by serial numbers. Yeah, we'll talk about that one in a little bit too, because I have witnessed people do that, and I'm like, you need to delete that. That's crazy. I'm not walking out here with you. You're not even my employee, and I'm not walking out here with that. URLs, which would be, or IP address. You know, think about if you can link something from your billing system and email it to somebody or text it to somebody. A URL could easily, because I thought about URL, I thought, how would that relate? But some billing systems would let you do that. IP address, any identifiers including fingerprints, voice prints, face photography, images, or any comparable images. I saw a lot of surgeons that got in trouble during surgery taking pictures of massive tumors or things like that. The biggest issue is the more you want to take a picture of it, the more unique it is, the more identifiable. So that was the biggest issue on those. And any other unique identifying numbers, characteristics, or codes can also break the HIPAA rules. So here we go. You're working from home, and we all do it. We all bring papers from home. We all have to work at home sometimes. And you're in an unsecured area, maybe your kitchen, your living room, where documents or patient information is unsecure. Is that a HIPAA violation? Yeah, that one's everybody's shaking their heads on. That one's kind of an easy one. You don't really think about it because you love your family. What are they going to do? They're not going to say anything. They're not going to take a picture. They're not going to do anything. But we have a story to talk about in a minute. Yeah. saving a patient's contact information in your cell phone as a contact, is that a HIPAA violation? Who says yes? So who says no? No, I promise I won't stick Katie on you with the microphone. Just tell me yes or no. I promise she won't do it again. Okay. Okay. All right. And taking pictures of equipment in the patient's homes. Who thinks that's a violation? Yeah. Okay, let's talk about it. A DME provider was ordered to pay $239,800 in penalties for violating the HIPAA privacy rule. An investigation began when a DME company was reported that an employee moved out of their home to another home, and the information was left at their home office of over 278 patients. I actually know about this story. And nobody planned on leaving their home that night, but their boo had their texting information. So they left their house really quick that night and didn't take all their information with them. And somebody was really mad about that, what they saw on that phone. And they were trying to get them fired. We're going to learn, though, later on, who really pays the price, who had to pay that money, not that person, but their company had to pay it. They were trying to get their ex-spouse fired because of their home office. I mean, it's crazy, but that's the case, you know. And this was from years ago when we did a lot more on paper than we did on electronic devices. Apps. A lot of you said it could or could not be, and you're right. Your work phone could be encrypted, protected, and everything's fine. As long as you don't have any kind of apps that can access your contacts or your pictures. Because all of us probably on Facebook have our contacts. You can get in my contacts, you can add more friends that way. Or you're going to add a picture, it needs access to your pictures on any social media platform. Not even social media platforms, other texting apps will pull your contacts in or any of that. So, I mean, those kinds of things that people aren't really thinking about when they hit yes, you can access my contacts because I want more friends, but yet they've got patients' contacts saved in there. So who regulates HIPAA? Because I really didn't know. And I thought this would be a very interesting slide to talk about. So it's the United States Department of Health and Human Service Office for Civil Rights, or OCR, as we're going to refer to it the rest of the talk. They're responsible for enforcing the HIPAA privacy rules. So from 2003, when it was started, to 2019, the OCR has investigated and resolved more than 26,683 legal cases by requiring changes to private practices and correcting action by or providing technical assistance to HIPAA-covered entities. You can go on to the website and you can actually see the violation, who committed it, what they did to correct it. A lot of the times, they put policies in place, stricter policies in place, more education, better education. You know, those are the kinds of things that they'll do right off. Some are so serious, maybe a lot of them were payers that got hacked. And you can actually see from year to year to year how it's grown over and over time. But technology has grown over and over and over. Hackers are getting better. You know, people are getting more careless with things that they're doing. So the OCR has also settled or imposed civil penalties in 63 cases, totaling $99,581,582. That's more now. This one in 23, I couldn't find the exact number, but I mean it's gone up so much in just this from 2019 to now. Many people mistakenly believe that an individual can be sued for a HIPAA violation, and that's untrue. In fact, your employer or the covered entity is responsible for your HIPAA violation. You cannot be sued or be penalized, your employer will be, unless, we're going to talk about it in a minute, you can actually go to jail for breaking HIPAA laws. And we're going to go over a couple different cases of where that did happen to people. As a clinician, the most significant risk from committing HIPAA violation and the most common is losing your job. Now, you can be sued by the person that you did commit the HIPAA violation on if they can prove that you caused them harm, grief, any of those legal words that they can use. They can come after you directly. And there's been many cases, especially the Snapchat cases, of healthcare workers videoing patients in very compromising positions, and it's just sad and disgusting. I didn't put any of that in my slides, but a lot of those are criminal cases. And the families were able to go after those people as well. So I thought this would be a really cool slide to put together here. This is how it works. So the OCR is going to get a complaint, and they're going to review it. And if it meets these 4 requirements, then they're going to say it's resolved. And, happened more than 6 years ago. They're not even a covered entity. The complaint was not filed within 180 days, and an extension wasn't granted. So if you think you've been compromised and you have a HIPAA violation against even you personally, you have so long to report that to the person or to them. The incident described in the complaint does not violate the HIPAA rules, so they will stop it at that point. If it does, they continue on. And if, like I talked about in the Snapchat, possible criminal violations, they take it straight over to the DOJ, and they're like, that's for you to handle now. They will look at the violation. They'll see how they want to resolve it. And like I said, most of the time, it is something like stronger education, those kinds of things. But in more formal times, they will do an investigation with the Department of Justice, and they'll work with them to do the investigation so that they can do civil penalties against the organization and decide if criminal charges need to be fired. All right, not filed. So here are the 4 steps. If you look in this second circle here, tells you kind of the breakdown of the level of charge that has to be from the investigation, the finding from the investigation. That's where you're going to fall at in the tier. And this is all about the money part of it right now. So you can be fined on this third up to these costs for any of these violations. And you can see the first one is unaware of the violation and would not have known even after exercising due diligence that I had no idea I was creating this. One example of that was a physician from another country moved here and could not be a physician. So he actually started working for a research company, and he kind of got some issues hang up on getting his license, and so the research company said, okay, well, we'll keep you, but really can't let you work yet. Honestly, he was bored. And he had access to a lot of celebrities in his medical records. And he went in and he read about 110 celebrities. He never shared that information. He never told anyone. He didn't sell it to the magazines. He didn't do any of that. So he didn't think he was doing anything wrong. But somebody found out about it, and he was fired for it. He didn't know. He honestly didn't know he was doing that. So he was not sent to jail. He was not fined the money personally because he truly didn't know. We're going to hear about somebody who in a minute looked at 111 and did go to jail for a year because it was vindictive. So then you've got the tier 4. They willfully, neglectfully denied HIPAA. The rules and no efforts were resolved to fix it within 30 days of the discovery. So that would be a company's maximum fines there. If they knew somebody was searching records they shouldn't be in, They did nothing to stop it, those kinds of things. If you knew you were potential for a hacker to come in, you already had a warning, something like that. I saw some cases like that about, that would be these maximum fines. So now this is the criminal. So we've already talked about how you can be charged criminally and in what instances someone can actually sue you personally for the HIPAA violation. These are Tier 1, Tier 2, and Tier 3 of the penalties that you can do. I will tell you in all my research, Tier 1 was the most common, and with probation of 3 to 5 years usually after. Tier 3, I saw a lot with those Snapchat people getting Tier 3. And man, they deserved it. And more. It was... So, I'm trying to stay on time. I think I'm doing all right. All right. So, this one is the one that we were going to talk about that was the vindictive person on social media. She basically worked at a construction company for 24 years. I saw a lot about this case. I read a lot of different articles about it. And she was replaced by what she thought was someone younger who was better with technology, and she was very upset about it. She got hired in at a hospital system in Pennsylvania, and she realized that that person she got replaced with had been going to the physician there and going to the doctor there and the hospital in that system. So she got into all of this victim's records, called back to her employer, and told her all of the gynecological results that this person had, and left it on voicemail. Yes. So then she thought that was so fun, she would do it to the rest of the people in the office she didn't like, and leave it all on their voicemails at night for everyone to hear the next day. She would send it in emails. And then she thought, well, this is so cool, I'm going to go back to high school. She's 62, and she went back and looked up people from her high school and posted on social media things that she found about them. She then got fired from the hospital system, okay? Because it was definitely brought to their attention. She got fired. She got hired at the next hospital system down the street and continued this behavior. And so after 111 victims were found that she actually violated their HIPAA, she would either post about them, leave comments, tell someone all of their medical information. She finally ended up fired and in jail. She spent a year in jail, and she got 3 years probation for what she did. So I'm kind of out of that HIPAA phase now. Let's talk about you. I did some research on candidates getting hired and interviewed and how their social media can affect them. Yeah. Career Builder did a survey. 70% of employers use social media to screen candidates before hiring. 57% are less likely to interview a candidate that they can't even find online. You must be a weirdo if you don't have anything. Yeah, I mean, so they won't even bring you in for an interview. Isn't that crazy? That one kind of surprised me. 54% said that they've decided to not hire a candidate based off their social media profile. So here are the reasons why that were top of the list of why they did not choose to hire people after seeing their social media profiles. Candidates post provocative or inappropriate photographs, videos, or information. Yep, they were drinking or using drugs or promoting drugs on their Facebooks. They had comments related to race, gender, or religion, bad-mouthing previous companies or fellow employees. They lied about their qualifications, and that was discovered on their social media. They felt their posts had poor communication skills in them. They were linked to criminal behavior. A lot of people won't only just click on you, they'll also click on your spouse or whoever you're dating or your family. Some of them went deep in some of these that I read about. Confidential information from a previous employer was shared. The candidate's screen name was unprofessional. How many people in here do interviews and hire managing? Have you ever gotten any of those hilarious emails where you're like, I ain't calling you? Like, who puts that up there? Like, it's some crazy stuff. Like, be a little professional, my gosh. Yeah. They also lied about why they're absent. This was a big one that had a high percentage because somebody would say they stayed out with a sick relative or family member. And then, they just posted too frequently. You're going to be on it all day. You ain't going to do a job for me. So that was also the one. Your current employer can also look at your Facebook. Many people have lost their jobs because of what they post on Facebook after they've gotten a job. Half of employers check current employees' social media profiles, and over a third have reprimanded or fired an employee for inappropriate content. And I'm going to imagine inappropriate content would reference back. This study did not have all of those, but I would imagine that last slide probably covers it. Companies have you sign an employee agreement, code of ethics policy, or social media policy. The verbiage in this can make what you post on Facebook a fireable offense. Your employer or potential employer has the right to search your social media. They do not have the right, if you're private, to say, I need to look at your social media before I can hire you officially. Or, you work for me, so I need to see what you're doing on social media. You do not have to make your private pages public. However, in that, let me just say, somebody's probably on your Facebook that's going to show them. So don't take too much stock in that. Don't feel safe on that part. And then they do not have the right to ask you for your passwords. Do you know how many times I saw that? And I thought, do people really ask people to give them their passwords? But apparently so, because that was top of the list on many of the items I looked at. So they do have the right to look at anything public you post. So in closing, I say, protect yourself. No one should ever post anything about a patient on social media, even in closed groups or on a personal page. Social media is the opposite of private. It's never really private. Keep your social life and your work life separate, and only post to social media what you want and is appropriate for the whole world to see, because that's exactly who may be seeing it. And I'm 5 minutes, so if we have any questions. No, Lord. Yes, Katie?
Just a real question.
Put your mic up for the people at home.
Okay. So I know you said that as an employer, if your employee breaks HIPAA, then you're fined. But so, for example, what if it's one of our ex-employees from 2 years ago, but they come and post today about a patient that they had of ours? What happens then? Who, I guess, is...
I mean, that's a great question. I actually didn't find any, that's a really good question. I didn't have any of my research really cover that, but I would imagine that if it was reported to the OCR, they would investigate it, and they would find out this is just me off the top of my head, how they got that picture. Did you know they had that picture? Did you allow them to have that picture? Did you put them in a situation they could take that picture? And did you train them properly to not have that picture took? I think it would still fall back on you if they were on your time and you didn't train them appropriately. That's my answer. I don't know for sure, but that sounds like what I would say.
Just wondered.
Okay. Any other questions? Yeah? Eric, really? I'm not going to lie to you right now. He said, is it a HIPAA violation to talk about HIPAA violations? I'm not going to lie to you right now. That's good, because I had that thought. That is why I chose not to put the pictures and things up there. But everything that I talked about today, the only thing I couldn't verify was that doctor's screenshot. But I mean, it's out there, so I thought it had to have been, there has to be something, some penalty to it. But everything I talked about today has already been investigated and fined. So yeah, but good one. I mean, I would think it could possibly be. Yeah. No, I think you're good on these. We're going to post them. Everything on here is fine. I think you're good to talk about what I talked about today. But no, I mean, it is a valid question, honestly, and don't expect anything less from you. But yeah, it is a valid question. But I think you can talk about anything I did today, because I made sure that I only talked about things that were already been investigated. Yeah. Okay. Yes, sir.
Well, my question is that I know in my work, I work from home, and I took calls from patients and were typing them into my computer. And even at home, my employer had to be sure that my computer was not visible to any of the rest of my family.
Mm-hmm. Yes.
Cell phones and people who use their cell phones for work. Even if you're on your own cell phone, which is your work, it's got all of the proper securities on it. If you're doing something on your cell phone in places that are public, couldn't that potentially be a violation?
Oh yeah, absolutely. Yeah, I mean, we talk to our employees a lot about knowing even hooking up to public Wi-Fi is a risk. So you're absolutely right. You need to protect your computer and your phones at all times, because if anyone sees it, it could be a potential HIPAA violation. Yeah, that's a great point. Thank you, Mike. Anybody else?
Any other question? Over here.
That's a tricky one. I will tell you that in my research I did find, oh yes, sorry, that he asked if it was a HIPAA violation if you call the doctor in the middle of the night and they ask for a screenshot of an arrhythmia to be texted to them so they can see it. So I will say in my research that I did see a case similar to this where a group were texting their physician for orders. And they did this regularly, and they had a group chat. And the people that were involved in this did get fired. I don't know the 100% of what was listed, but I do know that it did say that patient identifiers were leaked. So I think it goes back to... Mm-hmm. Yeah. I mean, as long as there's no patient identifiers, you should be fine. However, if you get in trouble, you ain't coming after me, because I can't say 100%, but I'm not a specialist. Yes, yeah.
Okay, I
But,
saw
yes,
one other
that was-
person with their hand up. Yes.
Okay. So she asked...
Ruh-roh.
So she asked the question, if a patient or a family member wants to take a picture with the staff to post on social media to say, when a patient meets a milestone, to just commend those people around that have helped to get that patient to the milestone. And what I'll say is, if it's the patient, that's their business, that's their right to do that. A patient, I did see this very clearly stated in the laws. The patients can't commit HIPAA violations. If they want to talk about their own journey, they're completely allowed to. They can talk about it. Family members, that gets a little iffy. I would see not being comfortable with doing it for a family member as much as I would the patient. Because you never know if that family member is truly being genuine. It could be somebody the patient's not comfortable with but don't want to say it in front of them. That one's a little different. I think you'd have to be in the situation to know the family at that point. But the patient, for sure, you could.
Okay,
Yes,
one
sir.
more, and
Is this
that's all we have time for. Do we have any from home? Okay.
It's real quick. It's not really about HIPAA violation, but it just makes you think. Andrea and I work at a small LTAC in Parker, South Carolina, but this happened probably 12, 14 years ago. The whole night shift
Okay, wait.
was,
Sorry.
I'm sorry. So this happened at LTAC, at our LTAC about 12, 14 years ago, and it's not really about HIPAA violation, but the whole night shift was having a going away party in the break room, gathered in there about 3 a.m., and they did a group picture. And it was posted on social media. But the problem with that was, and there was name badges in the picture, and if you zoomed in you could see it, but that was not the issue. We had a family member of a patient who had been with us long term said, y'all were not taking care of me, taking care of my loved one. I'm pushing the call light and no one was responding timely. Another whole situation.
Yeah. Yeah, you're right. And, I didn't even touch on the whole selfie at the nurse's station things and, but you have to be very careful of your surroundings. And again, it's best to keep your personal life and your social life separate because it could be things like that. I mean, that wasn't HIPAA necessarily, but it was in that patient's mind in poor taste. Yes. I've always told everybody, the only reality that matters is the other person's. No matter what you were doing, you knew you were on break, you knew you were good, you knew you weren't neglecting them. That's not their reality. Yeah.
Thanks, Carrie.
Yeah.
You always do a great job for
Oh,
us.
thank you.
Thank you so much.
Thank y'all.